Periods are a normal part of growth and puberty, but they can still be really confusing and complicated. Take Helen. She's been having periods for a little while, but it may take her a few years to settle into a regular cycle. Though every body is unique, each eventually finds its own rhythm. Periods usually last a few days to a week, coming at a similar time each month or cycle. Cramps and bleeding can vary in intensity and amount for everyone. There have been times when Helen's period was very light and only a couple days long. Hello? This is Mary. Mary has congenital adrenal hyperplasia.
CAH is an inherited condition that affects the adrenal glands and hormones in both boys and girls. My periods are very different, and the balance of hormones can make my cycle change.
CAH causes Mary's periods to be quite unpredictable. So, how do Helen's periods work? Periods are the result of hormone changes, and hormones are our chemical messengers. Helen's ovaries will release the hormones, estrogen and progesterone, which then cause the lining of the uterus to build up. They also cause an egg to leave one of her ovaries. This is ovulation. The egg then travels through the thin fallopian tube to the uterus. If the egg is fertilized by a sperm cell, it can attach to the wall of the uterus and develop into a baby. If the egg is not fertilized, the uterus lining breaks down, resulting in her period. It usually takes about a month for the lining to build up, then break down, creating a 1-month cycle. CAH may cause Mary's periods to behave differently. The adrenal glands of girls born with CAH produce very little to no stress hormones and large amounts of progesterone. Mary takes prescribed medication to regulate these hormones. However, her menstrual cycles seem to have differences. As with many CAH individuals, Mary's ovaries don't seem to release eggs every 4 to 5 weeks. This is anovulation. They also produce different amounts of progesterone. Her uterus has less buildup, breakdown, and bleeding. In some girls and women with CAH, it could also be difficult for blood to leave the body through the vagina, or in some CAH cases, the urogenital sinus. A urogenital sinus is when the vagina and urethra are joined together in the body and can be present in CAH individuals. Mary's doctors don't actually know if all of these physical differences are a problem for her.
How well do you know your periods? And how do you manage them?
Did you use pads when you first got your period? Pads are made of cotton in loads of different sizes and shapes, with sticky strips to keep in place on your underwear. Some girls find tampons more convenient than pads, especially for sports and swimming. Tampons are cotton plugs inserted into the vagina. Most come with an applicator to guide the tampon into place. The tampon will absorb the blood and you change it regularly, like pads. Menstrual cups are a popular choice too. Most menstrual cups are made of silicone and are also inserted into the vagina. They catch and hold the blood until emptied several times a day. Everyone has a preferred method of one or all of these options. Have you found which works best for you? Mary started with pads and then asked her doctors if she could use a tampon or menstrual cup. This all depends if you have a UG sinus. Mary likes to use an app to track her period and body behaviors. Most girls and women, with CAH or not, have emotional and physical symptoms during their cycles. Moodiness, sadness, anxiety, bloating, and acne are all normal side effects to hormone changes.
There are many things I can do to be healthy and keep my periods manageable.
Periods don't have to get in the way of being social, active, and enjoying life. Whether you have CAH or not, it's important to feel able and ask your doctor, a nurse, or someone you trust about your period and body. Talking about your period can help you get the support you need to manage it. Be engaged and connect with other women to share your experiences and learn from others. Live safely and prioritize your physical and mental health, and seek help when you need it. If you have CAH, teaching someone you trust about your routine can be helpful. Empower yourself and be proud of your body and how it works. Lead discussions about your health with your doctor and peers. Please look through our site for more information and resources about CAH.